Hello, thank you for joining us today for Partnering for Change, a review of the 2021 CoAge issues and how GGS members can get involved. My friends and colleagues from the Georgia Council on Aging and CoAge will be doing the majority of this webinar today, but before I pass it over to them, I wanted to provide a little bit of context of how GGS fits into this. Before I do that, I just want to give a little housekeeping. We are asking everyone to stay muted during the presentation. We are recording it so that we can upload it to our advocacy page of the GGS website. And we are asking you not to turn on your video so that everybody will see the presenters speaking. If you do have any questions, please put those into the chat function and we will take those questions at the end. Natasha, will you go to the next screen, please?
Yes.
So GGS is celebrating its 65th anniversary this year. And throughout those 65 years, we have, thank you, Maureen, we have done advocacy in a variety of different ways. It still is one of our key purposes, as you'll see here. I took this straight from our website, in addition to our education and training and supporting students. We still very strongly promote advocacy. However, instead of being what I would say a leader in advocacy, several years ago, we made the decision to support the Georgia Council on Aging and CoAge and their efforts to make sure that we weren't providing conflicting information to legislators, that we weren't competing for limited funds. We really wanted to have one voice, and that has worked very well in being productive in our legislative sessions. So again, it's not that GGS is no longer involved in advocacy, it's that we've shifted our role to be more productive and supportive of an agency that, as you'll hear, does this extremely well. Will you change to the next slide, Natasha? So some of the ways that we help support Georgia Council on Aging and CoAge is through sending out our advocacy alerts, sharing information with them, and trying to solicit information. For those of you who have read your October newsletter, you'll see in the advocacy session that we're looking for stories that we can use as we're speaking to legislators. So that's an example of helping get those stories and information for them. We support issues for consideration or submit our own issues. So the CoAge process allows for people to submit issues and for CoAge members to vote on those. And GGS in the past has either been one of the groups that has put an issue forth, or we have put our support behind an issue that has gone forth for consideration. So as a GGS member, you can let us know issues that are important to you, and that could become the GGS supported issue during that CoAge process. And we also volunteer at events such as Senior Week or other events, working groups, and other things that you'll hear about. So I wanted to share a little bit of that up front so that you could hear about the issues and about the ways to volunteer. And I wanted to encourage you as a GGS member to put your support behind the Georgia Council on Aging and CoAge, and to take advantage of those volunteer opportunities, because that is a way that we can continue our belief in advocacy by working together with other organizations to have one solid, clear voice. So with that, I'm going to turn it over to the Georgia Council on Aging and CoAge members to share their presentation. And again, I'll come back on at the end to ask any questions. So for those of you who are attending the call, please type your questions as you have them, and we'll take those at the end. And I just want to thank them all for coming on and sharing this important information with GGS today. Thank you.
Good morning, everyone, and thank you for joining us today. My name is Ruth Lee, and I am the chair of the Georgia Council on Aging. And thank you, Amanda and GGS, for giving us the chance to brief you on the 2021 CoAge issues and how you can get involved. This year, COVID-19 has prevented GCOA from meeting in person, but that has not stopped our mission to make a difference in the life of older Georgians. The 2021 GCOA issues voted on by CoAge members are funding for home and community-based services, funding for behavioral health and housing services, coroner notification, disaster planning equity, and telehealth for dentistry. GCOA takes our priority issues to the legislators in the fall and to the Capitol in January. Our main goal is to turn those issues chosen by CoAge members into legislative changes and budget funding. GCOA is very proud of our 3-year campaign to provide stronger safeguards for Georgians that are living in assisted living facilities and personal care homes. Alerts and letters sent to the legislators by CoAge members helped pass HB 987, which was signed into law on June 30th by Governor Kemp. Today, I am joined by Legislative Chair Maureen Kelly and GCOA Executive Director Kathy Floyd. And Maureen and Kathy will now give you a brief explanation about each of the issues.
Thank you, Ruth. Welcome, everyone. My name is Maureen Kelly, and I'm the Legislative Chair for the Georgia Council on Aging. In addition to being the advisory council to the elected officials regarding aging issues, the council also convenes CoAge. That's the Coalition of Advocates for Georgia's Elderly. As Ruth mentioned, one of our responsibilities is to turn CoAge issues that you voted on into laws, and effective advocacy is essential to getting legislative and budget requests passed at the legislature, and that's where you come in. The 2021 CoAge issues are separated into budget priorities and legislative priorities. Kathy and I will discuss the budget priorities first, and then move on to the legislative priorities. The first budget issues is for home and community-based services, or HCBS, as we say. This is a recurring issue for CoAge because of its huge significance to seniors and their caregivers. It actually provides support for older adults to remain at home by providing services such as home modification, meals, personal assistance, transportation, and many, many more. Without access to HCBS, people often end up in nursing homes, which cost taxpayers an average of 10 times more. GCOA considers funding issues vital.
Yes, thank you, Maureen. The current statewide waitlist number is just over 7,600. Now, this is an increase from last year's waitlist number at this time of 6,400. Georgia Council on Aging was able to advocate to restore funding that was originally in danger of being cut during the last year's budget cuts. In 2021, we are requesting new funding of $10 million to cut the waiting list by more than half.
Thanks, Kathy. Our second budget priority is behavioral health and housing. The goal of this issue is to expand a current service designed to help meet the behavioral health needs of older adults living in affordable housing sites and to prevent unnecessary evictions. Senior low-income housing providers tell us that behavioral health issues are the #1 problem. Without access to this housing, some older adults may have to move into other levels of care unnecessarily, such as nursing homes, or some even face homelessness. Kathy, can you actually tell us a little bit more about those services?
Certainly. Currently, this service is provided by the Atlanta Regional Commission in some areas of Atlanta. ARC has partnered with the Fuqua Center to provide behavioral health coaches who are focused on empowering individuals with behavioral health issues through a holistic and supportive approach. In 2019, this model resulted in a 99% success rate in avoiding evictions. The council wants to see the state expand the ARC model in 3 to 4 areas in Georgia in order to help residents with behavioral issues keep their independence and remain in safe and affordable housing. This issue from the providers of senior living is their #1 problem in their communities.
Wow. Now that we finished with the budget issues, we can discuss the legislative issues. And the first one is the coroner notification. Currently, long-term care facilities only contact their local county coroner in the event of a suspicious death, one that may have resulted in a homicide or resulted from an accident. The facilities are essentially put in a position to make those decisions and effectively police themselves. Kathy, hasn't this actually been a CoAge issue in the past?
Yes, Maureen, this is actually the 3rd time in about 18 years that CoAge members have picked this issue. Legislation is needed to require county coroners to be called for all deaths occurring in a long-term care facility. Allowing coroners to be notified of nursing home deaths provides an additional layer of protection for the family of deceased. The inclusion of coroners in the earlier stages reduces the chances of incorrectly determining the manner of death. I'd also like to reinforce the significance that this legislation would have on the family members and caregivers. They have every right to know how their family members died without any misgivings of abuse or neglect. Instances of invalid death certificates can postpone important insurance processes, financial affairs, and even burial arrangements. Coroners throughout Georgia are in support of this issue.
Indeed, we'll be keeping an eye on that issue as we do all of the issues, and keep our CoAge members updated throughout the legislative session for sure. The next priority is disaster planning equity. In times of crisis like the recent pandemic, resources such as PPE are scarce. When limited resources become available, a priority list is created. However, we found out quite painfully this year that long-term services and support providers such as in-home care workers and agencies are not on any priority lists and therefore not given priority. LTSS providers must be acknowledged as a priority in order to receive the necessities that continue the critical services and brought into the homes during the crisis, regardless of that client's designation or funding silos. It is critical that in-home service workers are able to continue making face-to-face visits, receive supplies such as PPE, to help keep their clients and residents safe. You know, with their breadth and scope of knowledge and experience, it's important that aging network providers be represented at the planning table before and during any future disasters. Kathy, do you have anything to add to that?
Yes, thank you, Maureen. We're asking our members and legislators to support this issue because there's a critical need for resources during these times. The COVID-19 pandemic left many in-home care providers without access to PPE. In order for Georgia to flatten the curve of infections, in-home service workers making face-to-face visits need protective equipment to prevent the spread of the outbreak. Legislation would specifically name the long-term care services and supports system providers for inclusion in all planning efforts, and especially for disaster and pandemic planning.
That's great. Thanks, Kathy. The final legislative priority is telehealth dentistry, or also known as Tele Dentistry. Tele Dentistry is a live two-way interaction between the doctor and the dental hygienist who's with the patient. Tele Dentistry can take several forms, such as a real two-way audio-visual telecommunication like we're doing here today, or electronic communications and facilities assessment. The goal is to pass legislation that would allow the dental hygienist to serve individuals in outside settings, and yet under the general supervision of a dentist. This model of care provides easier access to dental care for nursing home residents or people who live in rural areas with limited transportation. So Kathy, can you tell us a little bit more how teledentistry has actually already been used in Georgia?
Yes, during the COVID-19 pandemic, the Georgia Board of Dentistry permitted the temporary use of teledentistry in emergencies when dental offices were not open. This measure proved that teledentistry can bring about efficiency, provide access to underserved populations, and improve the quality of care to reduce the oral disease burden. Georgia has no laws to authorize a Georgia supervising dentist to send or receive remote communication, even though the state has engaged with telemedicine for over 20 years. Now, all of these issues are very important and play a major role in improving the lives of older Georgians. The support of CoAge members play a vital role in seeing these issues become laws. Our Deputy Director, Natasha Taylor, is standing by now to let GGS members know how they can get involved in moving forward. Natasha?
Thank you, Kathy and Maureen, for a great explanation of our 2021 issues. I know that you all have heard Ruth, Maureen, and Kathy mention how CoAge members voted for the 2021 issues. Let me explain a little more about how the voting process works. Every year, anybody can submit ideas to become a CoAge priority issue. The potential issues are presented at the July CoAge meeting, after which CoAge members vote to determine which 5 issues are taken to the legislature. Once the priority issues have been chosen, work groups of stakeholders and advocates for each issue are formed. Each group meets virtually once a month to brainstorm and share ideas on how GCOA and their advocacy partners can get legislation passed in the upcoming year. Work groups started in September, but there's still time to participate if you're interested. If any of you here today are interested, please put your request in the chat feature, or you can email Eric Ryan at ericryan@gcoa.ga.gov. If you are unable to participate in the work groups, you can still play an important role in helping to get legislation passed. One of the perks of a CoAge membership is access to our alert system. When you get an alert as a CoAge member, your specific legislator's contact info is loaded into the system. You get a sample message that you can customize if you want. Just 3 clicks and your message goes directly to your individual elected official, and you're able to let your legislator know how you feel about these important issues. As members of GGS, we know that you already have the desire to be an advocate for Georgia's today. You can join by visiting our website at www.gcoa.org. If you are not ready to be a member, you can still sign up for our Senior Issues newsletter, which will keep you informed on what's happening with each issue at the legislature and other important updates affecting seniors. If this conversation has whetted your appetite to find out more, please tune in to the October CoAge meeting on October 29th at 10 a.m. for a more in-depth look at the 2020 priority issues. We'll hear important updates from the Department of Human Services, and we'll be joined by the advocates who submitted each priority issue. You can register for the meeting on the GCOA Facebook page or at www.gcoa.org. Thank you for taking the time to listen today and for your interest in the GCOA and CoAge organizations. I will hand it back over to Kathy and Maureen for any questions that you may have. Kathy and Maureen?
Thank you, Natasha. And I think we're going to hear from Amanda.
Yeah, so right now we don't currently have any questions in. I encourage those of you on the call to go ahead and begin typing in any questions. In the meantime, in our GGS October newsletter, I highlighted some upcoming Facebook Live events you had where you'll be giving people some tips on how to be an advocate. Would you like to talk a little bit about what those are and how those might be helpful to people who aren't as comfortable advocating?
Sure, sure. The council made advocacy presentations a number of years ago. Before I was at the council, I participated, was a part of. I know Maureen had one at ARC once when you were still at ARC. So there is a history with the council of providing advocacy training. We haven't done one in a number of years, and we decided, actually our former chair, Vicki Johnson, had wanted to do it. We just, there's only so much 3 staff at the council can do. But we wanted to take advantage of the virtual setting to be able to do some this fall. And so we do have 4 scheduled, and we really wanted to set them up so that they'd fit anybody's schedule. So we have one on a Monday, one on a Tuesday, one on a Wednesday, one on a Thursday. We have one in the morning, one at noon, one in the afternoon, and one actually at 6. So we did that in hopes that we would be really available for anybody's schedule to be able to tune in. And the setup is we're gonna, kind of take you through some different, and it's set up as a pyramid. So you start with the very easy things that you could do. And then we talk about what takes a little more effort and what might take a little more effort. And then we end with things that, really super advocates have been able to do for CoAge. So we try to make it, so that anybody could take a part and say, I think I can do this part. I think I can do that part. It really is set up. And then we'll do Q&A, and of course we can help people with any of the parts that they want to take on to as far as advocacy is concerned. I'm now going to ask Natasha if she'll share the dates and the times for those with you, now that I've kind of laid out how they'll be set up. They'll all be virtual, and there are 2 in October and 2 in November. So Natasha, have you got those to share?
Yes. So the first one will be Wednesday, October 21st at 2 p.m. The next one's going to be Monday, October 26th at 12 p.m. And then we'll have 2 in November, one on November 12th at 6 p.m. and one on November 17th at 10 a.m.
Thank you. And we did have a question come in through the chat from Pat Baker. It says, I understand that area agencies on aging have received additional funds through the CARES Act and other special funding during COVID. I was surprised that the waiting list numbers were so high because of that. Any comment?
That is exactly the conversation we had at the first work group meeting in September. What do you think is going on? And it really is a combination of an increase in demand. We know that, as much as people avoided going into an institution, they are really afraid now of going into an institutional setting. And so the movement is to stay at home even more than ever. And so, of course, that puts a demand on more services. And also the AAAs shared that they have had a higher profile during this time. And people are discovering they are the best kept secret in Georgia. And as more people find out about them, then there's more demand that comes through, to their numbers. So, Natasha talked about the value of the work groups. As I said, that was the main topic of discussion at our first work group. Okay, how are things looking? What are you seeing? What's happening on the ground? And also to prepare us to talk to legislators, because one of the things that a legislator is going to ask me is, why are you asking for more money? The AAA's got a lot of federal funding. Why are you asking for more money? And we talked through and figured out the best message in response to that. And the best message back is there's an increased demand. The wait list is going up, not down. Plus, those federal funds give out September 2021. And we're asking for new funding in 2021. A lot of people are gonna be in trouble if we don't get some more funds to take over that, that burden that the federal money has been meeting.
So I thank you, Kathy. I'd like to add a little bit to that, just from a bird's eye view, as an organization that I'm with, the Thanks Mom and Dad Fund, that's keeping its eye on what's actually occurring out there. And what we saw was that there were so many seniors who were suddenly sheltered by the pandemic and told to stay at home, and they're still at home. And so what's happening is, even if only a portion of them end up needing services, many of them are declining because of the duration of this, because of the lack of access to any other services, because of them not getting out to the doctors. And so I think as time continues, that we're seeing more and more people declining and eligible in assessments to need and request additional services. So that's a significant population shift, if you look at it that way, Pat. And again, as Kathy mentioned, those CARES Act and Families First Act funding dollars will expire about the time all of this hits critical need.
I wanted to give a plug to Georgia Council on Aging. For some of y'all know this and some of you may not know, but throughout all of this COVID and what we thought was just going to be maybe a month or two, and is still continuing, agencies across Georgia have been meeting every 2 weeks to discuss what are those key issues and doing a lot of work behind the scenes. Kathy Floyd has co-chaired that with Mary Lee Boatwright Quinn, who is the chair of the GGS Advocacy Committee, and she's doing that in her role with the Alzheimer's Association. But there's been a lot of work happening behind the scenes for the hardest hit groups in Georgia. And so I just wanted to thank Kathy, and I know Mary Lee is not on, but thank her for that leadership. There's been some really wonderful conversations and research shared, and resource development and sharing of where are you getting your PPE and how can we talk about this and all of that. So there's been some wonderful things. Kim McCrae submitted something, totally agree, and there will be more people living alone with dementia who aren't able to go to their day centers, etc. And those are a lot of the conversations of that real concern between trying to keep people safe and understanding the social isolation and those other problems, and how are people trying to open safely. And oh, Mary Lee is here. Thanks for the shout out. Yes, thank you, Mary Lee. So just know that as this continues, there are a lot of people behind the scenes really keeping an eye on the situation, talking about these very frequently, trying to figure out how to mitigate all of those concerns of keeping people safe, but also allowing them to still see their loved ones and get the services that they need. And I just want to thank y'all for your leadership there. I apologize if you mentioned this and I missed it, but have you already put your brochure of issues together, or when should that come out? It's always a really wonderful resource for people to know how to talk to their legislators about that issue.
Thank you. We are in the process of creating that brochure. It will be ready for the October CoAge meeting. And I want to share with folks that our graphic designer is creating a kind of online interactive brochure. Since so many of our things now are virtual, we will have the print version for folks, but we're doing a smaller print job and putting a little more into the version that's going to be on our website. It's interesting how things developed. It was probably 4 years ago that Izzy from Sewega said, you should put this thing online. And we went, okay, yeah, we should put this online. So the next year we put it online. But this version this year is going to be more interactive with pop-up boxes, and you'll be able to see it all on one screen. And the hope is that people will send a link to that brochure to their elected official. How easy will that be? You send an email to your elected official and say, please check out this link. And you go to the link and it's all there on one page. You know, as they hover over one of the issues, more information, you know, pops out at them. So we hope that that will make it really easy for folks to share with their legislator. And we will reveal that product at the CoAge meeting in October, and then just that next week in November, we'll have the print version. And as always, you can contact our office and Eric Ryan, and he'll get you a supply of the print version also.
That's wonderful. It sounds exciting. I'm excited to see it. I like the format that you described. I think that will be very helpful, especially where people may not be meeting with their representatives in person as much right now. And that brings me to kind of my next question is, obviously, it's so hard to think ahead with COVID. We don't know what it will look like, but I'm guessing that given how long it's stayed around, there's already discussions about what's the legislative session going to look like next year and what that's going to look like for you all being there in person in those meetings. Do you have any sort of comments on how you see this year being slightly different and what people should keep in mind as they want to advocate but also be safe?
I would say it's even more important for you to establish that email connection with your legislator, and do it as soon as possible, because you know how we get when we get real busy, things go into spam, we never see them. So if you go ahead and set up that, and right now is perfect because they're all up for election in November. So surprise, surprise, they're paying a little more attention to their email at this point. So really good time to go ahead, send them a quick email. You know, you can ask them, you know, something as generic as, what are your plans for issues that impact seniors? You know, just really open-ended and see what they say. But you set up that conversation. Now, we will have information right after the election about, you know, who survived and who didn't, because we will see some change in the legislature. We've had quite a number of folks retiring. We won't have Renee Unterman to rely on, for instance. Several of our champions are in very, very tight races. So we will have some change. That'll be the first topic of conversation when we have our work group meetings in November. Okay, who survived? Who can we still count on? You know, who's new that we know will be a good supporter? So we are on top of that information and be able to share that. But go ahead and establish that communication now. And if you're able, get a cell phone or follow them on Twitter, because that often is a key thing during the legislature. I know it was a few years ago when everybody and their brother was trying to get to Renee, and she was not coming off the floor the last few days. You know, she wasn't answering her texts, but I messaged her on Twitter and she answered right back. So, you know, there are these different ways that you can get in touch with these elected officials. And if you use that method, when it comes to crunch time, you'll have that access. I know during the June session, when we were working on HB 987, because of Maureen's close relationship with PK Martin, her state senator, we were able to get a key piece of information because of that wonderful relationship. I don't know if Maureen, if you want to share a little bit about, you know, how that worked, but we were all, you know, operating under, you know, new conditions, because even though you can go to the Capitol, they walled off the entrance to the state Senate and the state House. So even though you were there, you couldn't get to them. They got off the elevator and went right in, and you didn't have any access to them. So Maureen, just, give them a taste of your, the fact that you had that relationship helped us out tremendously.
Yeah, it's interesting because it's taken a couple of years, but I've reached out to Senator Martin, and he has been helpful on so many things. I was able to call him and find out about the PPEs and get some assistance with connecting to the right people. If you develop that relationship, it isn't just about legislation. Of course, once that relationship is developed and they know they can trust you, and you can trust them, then you have that strong relationship. When something like this comes up and there's a question on one of the issues, you will be the go-to person, and you can help explain that, as well as ask questions at critical junctions in the process and say, hey, is there any way you can help us move this further along? And it is surprising, with just a little bit of effort, the way you meet a neighbor. These are the people who represent us, and they are the people who are looking for us to ask them questions. And so it doesn't take too much effort. It just takes doing it. And so pick up the phone, introduce yourself, and ask them if you can come to them with any questions, and ask them if you can send them the issues for this year. I think that was one of the first things I did, was introduce him to the CoAge issues. I will say he's been an excellent senator for me, and it has proved valuable that I've been able to go to him and ask him the right questions at the right time. So I would encourage you to do it. It sounds like so ominous until you just pick up the phone and say hello. Try it. You'd be surprised. They are there to work for us, and they know that, and they're actually happy to help you. So do reach out.
That's some really great points, Maureen, that it does seem a lot harder until you try it, and they are there to work for us. And so we shouldn't be intimidated to talk to them, that we should feel comfortable bringing the issues that we feel are important. And the Georgia Council on Aging, Kathy and Natasha and Eric are such wonderful resources with their brochure and helping you know those talking points and what to say so you feel informed on those issues. I want to reiterate, although GGS sends out advocacy alerts, I encourage all of you to become members. There's a bit of a delay between when they send out an alert and when we send it out. And they have such a wonderful system that Natasha explained, of it being tied to your specific person with the email set up. It's so easy, and it takes out some of the steps. So although we support them and send those out so that people who aren't members can also take their steps, it's a much easier and seamless process if you're a member, as well as just getting it right then. And sometimes that, if I'm not right there at the computer to resend that out, I mean, that hour can make a huge difference. When it's crunch time and there's about to be a vote, and it's like, we need you to send, flood their inboxes with support of an issue, we really want you to get it as early as possible. So again, we send that out, but I highly encourage you not to say, well, I get it from GGS, I don't need to be a member, because it's a much easier and faster process, and we want to try to support them with our memberships as well.
I love it when I get it, especially seeing what's been developed over the years. This one is hands down the easiest. It comes to me, it's already connected me to either my representative or my senator, or sometimes some additional people. But the message comes in, it's in an email, ready to send. You can take that out and put your own words in it, or you can leave it as is and just send it. Just push a button and send it. That's how easy it is. Thank you to the staff for developing this easy way to advocate and make our voices heard. Thank you.
It's extremely useful.
Well, it is the most, it is the most expensive thing we pay for each year, but I think it is worth it. For sure. And it helps us too. I have had an instance, because it tells us who acted on the alert and who they sent it to. I can see if we have a representative who hasn't gotten any, and then I know to try some other ways to get information into that legislator. And it also gives me the opportunity. I have had a legislator who was somewhat hard to deal with say to me, I haven't heard from anybody. And I was able to say, well, I know that, you know, 3 of our members did send an email to you. I'm sorry that it didn't, you know, it didn't pop out among the, you know, many that you get. But, you know, so it does, you know, give us some information to, you know, to then go back. So it's a very helpful tool for us, for sure. So
that's another wonderful reason for me to encourage members to utilize your system. If they get yours and ours, make sure you're using theirs, because that's going to provide that important feedback back to them that, as Kathy just mentioned, that they can use to have those conversations. So that's extremely important. I feel like a lot of times it's during the legislative session that people start thinking about, man, I really wish we were talking about issue XYZ.
and I'm sorry.
Sorry, I think my
Is
internet,
that
I missed
mine
the
or
question.
I
Amanda's?
think it's mine.
Maybe all of ours.
I think
I was
we all
just
kind of
gonna-
froze for a minute.
I was just going to add that, of course, we convened Senior Week, and it's going to be very different next year. And we are investigating ways to make it kind of a virtual setup. And really, we have some space reserved in front of the South Steps, and we probably going to be using those days to set up some virtual connections with our, you know, our folks that usually visit. So, you know, if we're able to say brains communicate, just investigating, and we're going to have a setup that provides the best, you know, the best opportunities for folks.
Speaking of Senior Week, your Distinguished Older Georgian nomination recently went out. Do you want to put a plug in for that quickly?
Sure. Again, I'm going to go to Natasha if she will share some information. We have a call out for that every time this year. We really hope folks will send some names in.
Yes, so the Distinguished Older Georgian nomination form was sent out with our newsletter. If anyone wants to make a nomination, Kathy, can we share that with Amanda to send out to her members?
Sure.
Okay.
Actually, I included it in our October newsletter, which went out this morning.
Great.
So if you'll read your connector newsletter in the advocacy section, there's already a little plug-in for the Distinguished Older Georgian nomination.
Perfect, perfect. So the Distinguished Older Georgian Award was created in January 2003 by the Georgia Council on Aging. And we normally present our winners with the award at Senior Week. As Kathy said, we're going to figure out how we do that this year. It'll probably be a virtual presentation, but nominations do need to be turned in by November 6th, 2020. Last year, our recipient was Jerry Pops Barnes, who's been a very, very active member and advocate for seniors for a very long time. He's very active on our Facebook, and I think we just posted something today with a link to Pops and Kathy having a discussion about how important a CoAge membership is. So if you know anybody who is over the age of 70, correct, Kathy?
That's right, 70.
Yep, anyone over the age of 70 or 70 years young, as we like to say, please get in that nomination form so that we can see who our next year's winner will be.
Thank you. Again, if you have any questions, it's not too late to put those in. Abby, I see you turned your video on. I don't know if that's because you had a question or if that was by accident. Okay, I'm gonna.
Wasn't sure if I was supposed to be on, but I'm curious, did you record this? Because I didn't remember in time.
I did. So I'll be sending it out, and it'll be in our next newsletter, and I'll also be putting it on the advocacy page of the GGS website for people to look back. Thank you, Abby. I apologize. I lost my train of thought there. I had a question and then I lost it. It'll come back to me. I think I was telling folks that they could still go ahead and if they had any questions, put those in the chat. While those are coming in, I just wanted to briefly talk about advocacy beyond kind of the more traditional sense, which is what we've been talking about today. But at GGS, we also consider advocacy in the programs and the policies and the education and then the other work that we do. And on that note, I wanted to share the theme of our 2021 conference with you all, because I think it speaks to an area of advocacy that the world is very involved in at the moment. So our theme is gonna be the road forward, intersectionality and aging. Intersectionality is a lens through which categories such as race, class, gender, sexuality, nationality, ability, ethnicity, age, among others, are viewed as interrelated. It's a way to understand and explain complexity in the world and people and human experiences. And we are hoping that our conference will allow people to have a better understanding of how intersecting identities influence both strengths and barriers that older adults experience. So we'll be putting out a call for proposals for that soon. We've recorded a video that further describes intersectionality if it's a new concept for you. But that's an example of how we're using our educational offerings to look at ways that some of the older adults we serve may not have the same opportunities and access to resources, maybe experiencing health disparities and other things, and how we can look at the work that we do as individuals and as organizations to ensure that we are serving all older Georgians. And so advocacy, while we do a lot during the legislative session and we look at those things, is also something we need to look at in our own individual organizations and our own individual work to see if there's ways that we can advocate for folks who may have difficulty advocating for themselves or may need assistance there. So we encourage you to consider how you can advocate for the people you serve in those ways as well, if you have that decision-making power. I don't see any more questions come in. And so I wanted to just see if Maureen or Kathy or Natasha had any closing words they wanted to share. And if not, we'll give you a few minutes back of your day. And I just want to thank them for being willing to spend the afternoon with me, informing you all a little bit, and encourage you to take advantage of those additional Facebook Live advocacy sessions, the CoAge meeting, and becoming a member if you're not already. And with that, I'll turn it over to you for any final thoughts.
Thank you, Amanda, so much for this opportunity. Maureen, did you want to?
I just want to say, you know, we're all at home. This is a perfect time. Make the call, just do it. Do it to the candidate you want to win in the election so they already know you as a supporter, or to the incumbent candidate as someone that you have learned to trust. And so make the call now. It's really even more important now. And get your name known. Just do it. Use this time that we have to our advantage. Thanks, everybody.
Yes, I want to say thank you too for this opportunity. And I want to say that we do have our chair on, Ruth Lee, who started us off, but she is being a caregiver and helping out her brother in Asheville, and did not have the perfect setup for this, but she's a trooper. She's been on, but that's the reason we've not been able to see her beautiful face, is because she's actually being a caregiver herself. So thank you so much for the opportunity, and we'll all have a good week.
Thank you, everybody.
Thanks, Amanda.
Thank you.